We're now finding out the results of an inspection into the safety regulations in place at Palms West Hospital in Loxahatchee. This comes weeks after a nurse was brutally attacked by her own patient, breaking virtually every bone in her face. Our Jamilka Gibson joins us live outside the hospital off Southern Boulevard with what the report says and for some perspective on what was found out. Jamilka?
Investigators visited the hospital last month looking for potential deficiencies within state safety regulations. Well, they can report today they didn't find any. No deficiencies. That was the finding of an inspection carried out by the Florida Agency for Healthcare Administration on HCA Florida Palms West Hospital following a brutal attack on nurse Leelamma Lal. The report states the facility was in compliance with state safety regulations, meaning Palms West had the required policies and procedures in place to ensure safety and quality care, despite Stephen Scantlebury violently beating Leela, breaking essentially every bone in her face. Scantlebury was admitted to the hospital on February 18th for physical complaints. But while he was receiving care, he became a psychiatric patient as well. He was identified as a Baker Act case. However, Palms West is not one of Palm Beach County's Baker Act facilities.
They follow a lot of quantitative data. This is the worksheet that they have.
Dr. Sandra Rizaldi is a psychiatric nurse practitioner and founder of Nurses Against Violence. I asked her for her take on the report.
Historically, nurses and healthcare workers do not report violent attacks, or they don't report every detail or even any incidences that happen on the floors.
Now the question is there room for improvement to enhance security at Palms West or other HCA facilities? The hospital tells us they've already taken some steps. Just this week, they added a workspace for PBSO deputies in the emergency room. But healthcare professionals say more needs to be done.
There's no actual preventing programs to be able to be proactive to prevent violent attacks. This would include security, proper training. The training that they have is from a third-party entity.
Rizaldi says change starts with speaking up. She's encouraging workers to reach out to Congress about Senate Bill 1176. It would require the Department of Labor to address violence in the workplace regarding health care and social services. It's made little progress since being referred to a committee 2 years ago. Dr. Rizaldi is also encouraging nurses to report workplace attacks when they happen. Now, we reached out to the AHCA and Palms West for comment on the results of the report, but did not hear anything back yet. Reporting in Loxahatchee, Jamilka Gibson, CBS 12 News.